Well, good afternoon, everybody. My name is Sean Egan. I am the Director of COVID Workplace Safety for the state of Michigan, as well as the Deputy Director for Labor in Michigan's Department of Labor and Economic Opportunity. I really appreciate you taking the time to talk with us today as we continue our series in college towns to talk about some of the unique challenges that college towns face as students may return to campus. So we have Kevin Selmeyer, the Fire Marshal for the state, with us today, as well as Barb Sebastian from the Liquor Control Commission. We're going to do about a half hour or so of presentation, and then we'll jump into Q&A. If you would like to submit a question, there is a box at the bottom of your screen for questions to be submitted, and we will try to get to as many as we can before the end of our time today. It's important that you're engaging today, and we're focusing in on college towns because there are some unique challenges. We know that across the state of Michigan, businesses have been faced with a host of new requirements and other challenges to help contain and fight COVID. And certainly a college town or a college area adds a degree of difficulty because we're bringing in potentially a large volume of people into communities, and they could be from across Michigan or across the country, and in some cases from across the world. And I can tell you that we've been engaged in a lot of discussions with colleges across the state of Michigan, including Eastern Michigan and the University of Michigan, on things that they're working toward to make sure that they can get open and stay open. And we wanted to take some time to connect with local businesses to make sure that you understand your critical role in making sure that we get open and stay open and move forward together as we fight to contain COVID. And one of the things that we really have to battle is just complacency in ourselves, in our communities, and all over the state of Michigan, because we've been dealing with COVID for a long time, and I know that all of us are tired and we're fatigued, but it's going to be with us for a long time, and we just cannot allow ourselves to underestimate how big college students coming back to campus, as well as K through 12 reopening, are for our community as we fight to battle COVID. I also need your help to make sure that we get this message out far and wide, because you're choosing to be with us today to get this information, to learn more, to be able to do more. And certainly not every business is doing that. So it's critical that you work through your local chambers or other business groups. Just find businesses in your area and make sure that you're collaborating and working together, because when we find an issue, that quote unquote bad actor, that already means the act has happened, and that can create spread in our communities. So one bad egg can in fact spoil the bunch, or one bad apple can spoil the bunch, and it can hurt us all and change the dynamics of how we're moving forward in the face of COVID. And I also want you to think about not just what you have to do on the things we talk about today, but what you can do. What's the next step that you can take to deal with COVID? We have to really challenge ourselves to, in our own behaviors as well as our communities, to push forward, to make sure that we're pushing toward zero complaints and zero citations and frankly zero transmission to the best that we can. We know that we cannot completely eradicate COVID on our own, but there are steps that we can all take, and we have to do this together. And don't forget about the value of local action. And I know that in Washtenaw, for sure, the local public health department, local law enforcement, the local chambers, the local municipal leaders have been working together, because I've been on those calls, on things that we need to do to help our communities as college students return to campus. And that might mean other ordinances or local health orders on gathering sizes to shrink that down. We've seen those in some communities where they've lowered them all the way to 25 for those outdoor gatherings. Ordinances that might hold landlords accountable. I've heard of one community that has a known congregation point that hired security just to kind of help disperse people from those areas. We know, we've seen in the news across the country that as college students have returned to campus, that the vast majority are following the rules and trying to make sure they're doing their part. But there have been incidents of large gatherings, and that's really where we see COVID take off, and we need to do everything that we can. So for the business community today, some of the things that you need to do is you have to have a preparedness and response plan. And if you're not sure what that is, at Michigan.gov, COVID Workplace Safety, MIOSHA created a template for low and medium risk workplaces, which are the majority in Michigan, that you can use to make sure that you're developing the tools that you need. You must be doing those daily health screenings, and we'll talk about some tools you can use to do that. Make sure that you are requiring your employees as well as customers coming in to wear those masks. Follow those limitations on size. Make sure you're doing the postings in your closing areas that you can close, like your waiting areas and things like that in your establishment. And we're going to talk through other things that you can be doing. But I really appreciate you taking the time, and we're going to work through this information. But I can assure you, at the Michigan Department of Labor and Economic Opportunity, our goal as we move forward in the face of COVID is truly to get open and stay open. And if we follow these executive orders and some of the things that we're going to share with you today, and then think to that next thing that we can do, we can make that happen. We just have to stay vigilant, don't allow ourselves to be complacent, take some ownership, and do our part. One of the reasons this is so critical is that, Michigan continues to do well in containing COVID, but we've had 93,000 plus confirmed cases in Michigan and about 2,400 of those in Washtenaw. And we see in the age groups that the age groups where the number of cases is growing the quickest is in that 20 to 29-year-old space, that perfect college age space, where for a multitude of reasons, that age group is particularly helping to spread the virus in our communities, and we really need to contain that. And there's a lot of things that we can do to try to help. One of the most critical things that we can do is really reinforce and engage everybody in wearing the facial coverings. Now, there's a lot of noise and static around COVID. There's a 24/7 news cycle, and we know that we're hearing a lot, but there's things that have remained static from the beginning of the crisis until now. Most critically, those are social distancing, wearing face coverings, and practicing good hygiene. And the reason for that is that this is largely an aerosol transmitted disease, meaning large respiratory droplets that we expel when we cough, sneeze, talk, sing, shout, however, come out of our bodies, and they can, if we're within that 6 feet of social distance, or in some cases further, we can actually transmit that to somebody that's close to us. And with COVID, roughly 40% of those or so we believe that are spreading the virus are asymptomatic, meaning they'll never get sick from COVID. Or there's a percentage that are pre-symptomatic, meaning that they're out and about and they feel fine. So a significant percentage of spread is coming from those that never get sick or they feel fine, which is another reason these face coverings are so critical. And we can see from this chart here that when we had to do the stay home, stay safe order because our numbers were so high, that gets us to a practically no transmission risk because we are completely socially separated, and that works well. Our lowest potential chance of transmission comes when we maintain that 6 feet of social distance as well as wear those face coverings. And then we remain in a low state of transmission when we're both wearing face coverings. Some of the science tells us that when we're both wearing face coverings, it cuts the chance of transmission by as much as 70%. Now, whether or not we find in the long run that's the right number, it's still very, very significant. So this is just one of the most critical tools. And then we also have to keep in mind that we have to do that good hygiene because we can pick up the virus from surfaces. And if we touch that with our hands and then our eyes, nose, or mouth, we can certainly contaminate ourselves with COVID virus. So just those three pieces have remained static. And as we work through this information, think about those three pieces, and these executive orders, the regulations, the CDC guidelines are built around that concept of social distance, face coverings, and good hygiene. So to reopen and operate safely, most definitely you have to follow the executive orders that are built around those concepts I just mentioned. Make a good faith effort to adhere. Make sure you're training your employees on health and safety practices so they understand the things that they need to do. And we have a bunch of information that I'll touch on that you can find at Michigan.gov/COVIDWorkplaceSafety. And always make sure you check out the phased approach to re-engagement at Michigan.gov/Michigan MI Safe Start. There are 8 steps or more, but 8 steps that we focus on for keeping workers and customers safe. And we're going to focus in on administrative controls. So those are more behavioral practices. Think things like staggering start times, break times, and other tools. We also talk a lot about engineering controls and the information that we provide for you. And those are things that we consider more permanent. So that would be your physical barriers, ventilation changes, and other tools that you can do that don't require human behaviors for their compliance. But when we talk about administrative controls, for sure, some of those things you're going to want to focus on are access controls. And when we talk about our employees, we're talking about those health screenings to make sure that the best thing we do is keep that virus right out of the workplace altogether. Eliminating that hazard is the #1 way to make sure that you keep your workers and customers safe. And the health screening tool provides a mechanism for you to ensure that your workforce is staying out of the workplace if they're sick. Also, you'll want to think about, for those public businesses, how you're controlling the access of your customers. And there are a lot of things that you can do there. First and foremost is just make sure you're doing the sign postings that remind customers not to come in if they're sick. If you can, find ways to either do reservations. I've heard of some places giving away tickets so they can kind of know how many people are going to come to their place at any given time. I know that all of us are really used to just being able to pop in anywhere we want. Obviously, as we're trying to make sure we abide by those size limitations for our businesses and other things, we need to be able to control access to our place a little bit more. The distancing piece, that 6 feet of social distancing, which is so critical to make sure that we don't spread the virus to each other, keeping those tables 6 feet apart and other things. The sanitation techniques that you're using inside, there's a lot of information in the guidelines I'll mention later on how you do that and how frequently you need to do that, but you really need to be focusing in on how you're going to clean after a customer, how you're going to clean after the end of the day, and we'll touch on it in a minute, but that deep cleaning you may need to do if an employee or a customer comes down with COVID while they're in your place of business, to make sure that you're cleaning it up. Hygiene protocols for both your employees and potentially for your customers on how they may have access to sanitizer or hand washing stations. Certainly PPE we talk about a lot. Cloth face coverings technically are not personal protective equipment because they're protecting the other person from me. They're not necessarily 100% protecting me from that other person, but these cloth face coverings, as I mentioned, cut down on that transmission so significantly that you really need to reinforce that. What you're going to do for positive case protocols, certainly one of those is making sure you notify local public health as well as other employees that may have been exposed. And then ultimately, how you're going to handle a potential facility closure if you need to shut down for that deep cleaning or you have some kind of outbreak in your establishment. We have a quick guide for bars and restaurants, one of the many tools we have available on the website I mentioned at COVID Workplace Safety, that we'll run through quickly, just a couple of minutes, and it'll break down a lot of the requirements for these spaces.
For food service employees and their employers, there are new ways to work safely to help reduce the spread of COVID-19. Designate one or more worksite supervisors to implement, monitor, and report on the COVID-19 preparedness and response plan. Develop daily entry screening protocol for employees and contractors. Display a door or sidewalk sign with the services available, instructions for pickup, and hours of operation. Reserve parking spaces near the front door for curbside pickup only. Limit capacity to 50% of normal seating. Require 6 feet of separation between parties or groups at different tables or bar tops. Close waiting areas and ask customers to wait in cars for a call when their table is ready. Create or post communication materials for customers, including instructing customers to wear a face covering or mask until they are seated. Close self-serve food or drink options, such as buffets, salad bars, and drink stations. Require hosts and servers to wear face coverings. Food preparers should wear face coverings and gloves in the kitchen area when handling food. Install physical barriers such as sneeze guards and partitions at cash registers, bars, host stands, and other areas where maintaining physical distance of 6 feet is difficult. Limit number of employees in shared spaces. Provide physical guides such as tape on floors or sidewalks and signage on walls to ensure that customers remain at least 6 feet apart in any lines. And wherever you work, Here are some guidelines and safety precautions for you to do your part in reducing the spread of COVID-19. Limit close contact with others by maintaining a distance of at least 6 feet when possible. Minimize handling of cash, credit cards, and mobile devices, and wash or sanitize your hands after handling. Practice routine cleaning and disinfection of frequently touched surfaces and tools. Wash your hands regularly with soap and water for at least 20 seconds. Avoid touching your eyes, nose, or mouth. And be sure to follow these safety precautions. Wear face coverings or masks. Check for symptoms that often include fever or abnormal cough or shortness of breath. Stay home if you are sick or have been in close contact with someone who is sick. Report your diagnostic test results and exposures to your employer, and participate honestly and urgently in workplace safety training. For additional resources, visit Michigan.gov/MIOSHA.
So that's one of the many tools that I'll reference in just a minute that we have available for you, but it really cuts right to the requirements for restaurants and bars. We have videos for other locations there too, types of workplaces there too. So there are additional regulations which bars and restaurants and other businesses must abide by. They might be more restrictive or specific depending on your region or your industry. And one of the examples, of course, is that in that bar and restaurant space, if you earn more than 70% of your gross receipts from alcohol sales, you cannot have indoor service. So Barb with the Liquor Control Commission will touch on that in a little more detail than I am, but you know, keep those things in mind that you'll want to be looking at who you deal with, right? So MIOSHA certainly regulates pretty much every workplace in Michigan, and then certain businesses have other agencies that they work with as well. And we also have today, I mentioned Kevin Selmeyer, the fire marshal, to talk about some of the things that they do.
Hey, good afternoon. Thanks for the opportunity to be here today. Talk about the fire marshal and talk about how we interact with colleges and universities. One of the most recent changes was Executive Order 159, which allows colleges and universities to use spaces that aren't approved as educational facilities. So I'm in our rules from the Bureau of Fire Services, and in the statute it speaks to instructional facilities, i.e. classrooms, that they have to be certified through a process with the Bureau of Fire Service Plan Review. Under Executive Order 159, other spaces can be used to accomplish social distancing in classrooms, and there is a short form that has to be filled out by the college or university and returned to the Bureau of Fire Services. But the idea is to allow colleges and universities to create the space needed for social distancing and still have a safer learning environment. The other thing we want to talk about is places of public assembly. We know that a lot of kids are coming back to college. We know that they are out in the local restaurants. For the ones that are over 21, they're in the bars. Movie theaters, concert venues all fall under the definition of public assembly. We'll speak to this later, but movie theaters and concert venues and clubs, especially that 70% of the gross sales are alcohol, are currently closed at this time. We also want folks to realize that places of public assembly do fall under the jurisdiction of the Bureau of Fire Services. With that also being said, though, many times the local police and fire departments are going to be involved at the local level, probably when the complaint is made, but we are definitely here to assist and to work together to come up with a solution to protect the health. So that's one of the things that on this next slide we talk about capacity issues. Many of in Washtenaw County, you have very strong career fire departments in those areas. Where some of our conversations have been in some of the communities that are smaller that may not have a full-time fire department. Most will have an adopted fire code and will have a fire marshal or a fire inspector. They definitely can help you with if you're trying to calculate capacity. If it's over capacity on a building, and this could be any building, especially in the public assemblies, we will suggest that they temporarily disallow entering, or temporarily could include closing the venue. But there again, we're trying to educate and we're trying to work with the owners so that we can make sure that everybody is taken care of safely. The main focus of what we really wanted to share from the fire marshal's perspective is that we definitely want to work with local government. We understand it involves relationships. We think that it's important on calls like today or webinars to develop those relationships ahead of time so that we can determine if there's any licensing action and ultimately work together for a solution. If there are any questions after this, I'm giving you my cell phone number. It's 517-388-1761. The Bureau of Fire Services, State Fire Marshal's Office, we definitely want to be part of the solution to make sure that the return to school is as safe as possible, but also realizing that there are gatherings that occur within communities that also are going to have to be dealt with in the future. And that's where we would suggest that in many cases Sean had already hit on some local forms of government have ordinances and other things, is to look at some of those as ways to disperse crowds so that we maintain social distancing in the executive order. And I'll be available throughout the phone call or throughout this call to take questions at the end. I look forward to interacting with you. And if we can be of assistance, please reach out to us. Thanks, Sean, for the opportunity.
Yeah, thanks, Kevin. Now I'll turn it over to Barb Sebastian with the Liquor Control Commission.
Hi, good afternoon. I'm Barb Sebastian. Thank you for having me be part of your presentation today. Really appreciate it. The Liquor Commission, we enforce the liquor laws and rules in Michigan. We've also been enforcing the executive orders from Governor Whitmer. We do check businesses to make sure they're in compliance generally with laws, rules, and executive orders. Just to let you know, we also partner with local police. We work with them from time to time, and we provide them with funding to help us enforce the laws and rules and to make sure that businesses are in compliance. We do take action in some cases if we do find violations out there, but like Kevin said from the Bureau of Fire Services, we try to educate first. We feel it's important to make sure that our licensees know what's expected of them and what the requirements are. We do also provide education to licensees, mostly in groups and to other groups so that everybody is on the same page and everybody's aware of what the requirements are. I did want to mention that our website is a great resource, and thank you. On the next slide there, we've got the web address for us. We do have information about COVID. We have reopening resources for liquor licensees that let them know about the requirements, new permits that we have that were designed for greater outdoor seating and things like that during the COVID crisis, contact information, frequently asked questions, all kinds of things there that I'd encourage you to look at if you have time and the interest. If you have any questions for me, I've listed my email address there at the bottom of the page, sebastianb@Michigan.gov. You're welcome to reach out and I'd be happy to help you as much as I can. And I just wanted to share with all of you who are here today that the Liquor Commission is very dedicated to helping licensees getting open and staying open legally and safely. We know that these are very trying times and that a lot of you are doing your very best to operate safely. However, we know that the indoor bar scene, unfortunately, is a great way for coronavirus to spread. Most of that's based on human behavior, customers talking loudly, getting close to each other, crowding, dancing, drinking alcohol, which will lower inhibitions and impair good judgment. Unfortunately, those things have caused the 20 to 29 age group to have many more cases of coronavirus. We're hoping that that can change with education and with people doing their part. I did want to let the bar owners know that, and licensees in general know, that you are required to have your staff and your customers wearing masks, except for people who meet the exemptions. However, you do have the allowance to require customers to remove their masks for the purpose of identification, to make sure that they're of legal drinking age, and also to make sure that they're not intoxicated. You do have that authority, and we encourage you to take it. Right now, dancing is suspended, so your customers can't be dancing, no topless activity. Those things are set in place to make sure that people don't congregate, that they keep social distance, and that they stay safe. Thank you. I did want to mention real quickly the 70% thing that Sean had brought up earlier. There is a restriction in one of the executive orders right now that places that have 70% of their gross sales from the sale of alcohol have to be closed to indoor dining. We're going by the common definition of gross receipts. And if you aren't sure whether you qualify to stay open for indoor service, I'd recommend you check with your CPA or bookkeeper or look at your tax returns. Typically, those are the sorts of determinations we would look at to make sure that you're in compliance there. That's all I had today. Thank you so much, and I'll be available for questions at the end of the session as well.
Thanks, Barb. So we have a lot of resources available, and I would encourage you all to check frequently our Michigan.gov/COVID-workplace-safety site. There are industry-specific guidelines posted there for every industry that's been named in an executive order, and that certainly includes bars, restaurants, and retail. Those were created by MIOSHA to be in compliance with the executive orders, as well as CDC guidelines for those types of establishments. We have some reopening checklists and fact sheets there, which are wonderful tools to help you kind of get a jump start. As I mentioned earlier, there is a template preparedness and response plan created by MIOSHA for low and medium risk workplaces. Those are going to be the vast majority of workplaces in Michigan, including those that are bars and restaurants and retail. We have more of those videos like we showed you here, as well as posters that you can use to meet some of the posting requirements or go beyond. That includes the no mask, no entry posters. There's a few variations of this. Some of those things more for restaurants, like your waiting area is closed, please wait in your car, so you can help control the amount of people that are waiting around, not only inside, but outside of your establishment. And you can always find more information at the Washtenaw County Health Department. They've been doing a great job. We've been communicating regularly on how they're tackling COVID-19 and some of the work that they're doing. So make sure you check out the resources they have available. And in Michigan, local public health departments can have higher standards than you're seeing from those with DHHS or in the executive orders. So that's where I mentioned one community took the 100-person gathering site outdoors as long as you can maintain social distancing down to 25. Again, those resources we have at our COVID Workplace Safety site. We have a link on our site there to the Michigan Economic Development Corporation's Peer Michigan Business Connect program. That will provide a mechanism for you to find that PPE and other things that you need, and that includes hand sanitizer, physical barriers, face coverings. And if you are a vendor of one of those, I know a lot of distilleries transitioned over to hand sanitizer. You can connect your business with other businesses through that platform as well. So make sure you check it out. There's a wonderful app from the My Symptoms app, which was created by the Department of Health and Human Services, as well as University of Michigan folks, that will help you do that daily health screening I mentioned. As an employer, you go and sign up. You can put on there who gets notified of the screening results, and you'll get an employer-specific number that you give to your employees, and then they set up their account, and they can do that daily health screening right from their smartphone, tablet, or computer. That'll ask the questionnaire. It'll give them a green screen if they pass and don't have any symptoms of COVID. It'll give them an orange screen if they need to contact their supervisor and their public health provider, or not public health, their health provider, because they have flagged for symptoms of COVID, and the employers get a report of that. They're also opening up a portal, so you'll get some real-time data. So it's a great tool. It's free, and it'll help you meet that daily health screening protocol. As I mentioned, definitely check out the Michigan.gov MI Safe Start site for the phases of reopening. And over at DHHS, you can find some great information at the Michigan.gov Mask Up. Make sure that we're encouraging and reinforcing that masking requirement, because that's so critical to making sure that we prevent the spread of COVID in our communities, and we do that, get open and stay open. Oops, I accidentally clicked the link. That's what will happen. Our MIOSHA team also created a hotline early in the COVID crisis to make sure that they were accessible and available to employers and employees with questions about workplace safety and COVID. That is 855-SAFE-C19. That's available to employers to call in for things that they could or should be doing, and they will talk with you. And if needed, they will get you over to our wonderful consultation team that can help you through either on phone or at times in-person consultation to make sure that you're putting the right pieces in place. For employees, if necessary, they can get them over to the complaint line. That gets you right into MIOSHA professionals. The average wait time has been about 15 seconds. That's right, 15 seconds. and the average call is about 4 to 5 minutes with one of those professionals. So definitely use that tool if you have questions about what's going on in your workplace and things that you could or should be doing to make sure that you're maximizing the workplace safety for your employees and customers. And with that, for now, we will turn the program over to the question and answer period, and hopefully you had a chance to submit questions through the link at the bottom of your screen, which you can still do now.
Perfect. Thanks for that, Sean. My name is Erica, and I'm going to be reading off the questions that you guys have submitted in the Q&A tab there. As Sean mentioned, if you didn't already, you still have time to go ahead and add those in. With that, I'll get started on the first question. Can my employer force me to take a COVID test?
So the CDC, we're really following the CDC guidelines as it relates to testing, and there are executive orders now with some industries where testing will be required. Those include like nursing homes, long-term care facilities where staff are going to have to do weekly COVID tests. For employees that had symptoms and are trying to return to work, we would encourage employers that are outside of some of those industries that are requiring testing, like healthcare, some agricultural, that you really consider why you would require the test, because the CDC guideline for most of us in those medium risk workplaces or low risk are really advising to go along with the symptom protocol if you're having symptoms. In certain circumstances, an employer may want to encourage a test, but we would really want to get into specifics of why in that situation.
All right. And what is the best practice for maintenance crews who need to make repairs in rooms that have been presumed or positive COVID-19 cases? Isolate the student, PPE, etc.
Yeah, absolutely. So that's going to be a difficult challenge as colleges re-engage, right? And businesses that they're going to need to do that deep cleaning. So the maintenance staff there would want to follow the CDC guidelines as well as those MIOSHA guidelines on how we're doing cleaning in those spaces and the types of cleaners and otherwise. There are some specific guidelines around how long you wait and that kind of stuff to give the virus a chance to essentially die on its own, and then you come in. Some locations are using foggers, and there's different materials that go in the fogger where they don't actually have to touch anything. They can spray this, it's aerosolized either peroxide or other types of cleanings that will kill the virus on contact on the surface after a certain amount of time of making it wet. So what, as an employer and an employee, you're going to want to evaluate the type of space that you're going into and make a determination on whether or not you need anything further than just the cloth mask. Now, keep in mind that after the room has been evacuated, theoretically, the aerosol spread is not likely, but you want to make an evaluation depending on what was going on in that room, the type of ventilation in the room, and then the other needs. But some time for the virus to potentially settle and die, as well as what types of equipment you're using will determine like what you would need to go in there.
All right, and the next question asks, how are schools and companies keeping us safe when we all share bathrooms?
So one of the things that is required, so depending on your type of workplace, right, is that they're going to have to enhance cleaning, and that's going to be an area like a bathroom that's going to be very common, where the employer is going to need to implement a more frequent cleaning protocol, as well as maybe other mechanisms. A lot of bathroom doors have automatic openers to prevent people from touching it. They have automatic soap dispensers and either air dryers or those automatic paper towel dispensers. They're going to need to think through how frequently they're cleaning, how much that bathroom is being used, and how they're avoiding that cross-contamination from touching other surfaces.
All right, thank you. And are employers required to follow executive orders, or are they open to interpretation?
Employers are required to follow the executive orders.
All right. And do schools or businesses have to follow the CDC guidelines for cleaning when an employee tests positive, or can they sanitize how they deem fit?
No, they would need to follow the guidelines. So employees, professors and teachers are employees as well. So those workplace guidelines are going to apply. And there are guidelines for general industry as well as K through 12 that are posted. if you are not named in one of the executive orders, you're going to need to follow those general industry guidelines, which include the protocols for cleaning and otherwise. And those are largely based off the CDC requirements. So the executive order defers some things to those CDC requirements, and that's certainly a spot where you're going to need to follow the guidelines.
All right, and are colleges and universities required to keep indoor class sizes to 10 or less?
No, but they do have to abide by, I think, Kevin, you might be more up to speed on this than me with the classrooms specifically and how many people can be in there, but they do need to be doing the masking and social distancing. Kevin, do you have anything to add?
You're right, Sean, and that was part of allowing other spaces to be used, was to disperse the students further out, but still require the mask wearing and the 6 feet of separation.
All right, and if an employee travels to a hotspot within Michigan on company business, can or should the employee require quarantine for 10 to 14 days?
So the employer should be limiting business travel to the maximum extent possible, and we understand that that still means that people do need to travel for work, depending on the type of work that they do. And the employer and the employee, and the employer specifically, when they're making a determination about what exposure risk that employee has, that type of travel is something they need to take into consideration and either be thinking about alternative ways for that employee to go to those places, or what kind of protection they're going to provide if that employee does in fact have to go to those places. So if the employer is following the protocols and providing the right equipment, it shouldn't be necessary for that employee to have to quarantine at all, because they would have been likely not exposed to the virus, and that's the way they should be functioning in that space.
Great. I like this next question, Sean, and I think this is where you particularly have been helpful in terms of coordinating COVID workplace safety. But the question says, who do we listen to? CDC, state, World Health Organization, just who is right?
So the state of Michigan executive orders are going to be a primary tool, because that's going to regulate our behaviors as it relates to Michigan. And then from there, we're going to look to the CDC. The MIOSHA, from the beginning of this crisis, the team over there has been using the general duty clause. All employers in Michigan are required to provide a workplace that's free from recognized hazards. There's no question that COVID is a recognized hazard. They've been using that requirement to enforce the CDC guidelines originally, and then the executive orders as those began to develop as they related to the workplace. So it's going to be executive orders, CDC, and it depends. If you aren't specifically listed in an executive order, you're going to want to take a look at both.
All right, and if a business has a confirmed case among employees, is the business required to close long enough to complete the recommended sanitation process, or longer?
No, it's so the answer there is the good old answer. It depends. So it depends on your type of workplace. So if you have a confirmed case or a suspected case within a certain area of your workplace, you're going to need to get that employee out of the workplace, notify employees that may have been exposed to that person or also work in that area, and perhaps just close that area. Now, if you're like a small restaurant or otherwise, you're probably going to need to close to clean that area, but there's no 10 days or anything like that. It's as soon as you get that deep cleaning done that you should be able to re-engage.
Thank you. And what is the employer's responsibility in telling all employees that another employee had tested positive? Should the office close for a period of time?
So similar to the last question, it kind of depends on where that person is. Now, employers have a lot of obligations to keep information private, right? So just because an employee tested positive doesn't mean that the employer can say, hey, Sean tested positive, everybody. They need to handle it appropriately and make sure that they're going to talk with that employee that tested positive, determine what area they worked in and who was around them, and then connect with those employees specifically. So if you're in a large workplace where it happened on this end of the workplace, you do not necessarily need to notify every employee on the other end of the workplace. You really want to focus in on who could have been exposed and what area were they working in.
All right. And is MIOSHA really enforcing the executive order requirements with employers?
Absolutely. Absolutely. They are using the general duty clause, that clause I just mentioned, to enforce the executive orders as well as the CDC guidelines. We, like Kevin and Barb mentioned, MIOSHA's goal is always to educate first. We recognize that the novel coronavirus, novel meaning new, meaning that we're all kind of learning together, and you should be checking those guidelines and making a good faith effort to comply. So it's not their intention to come and hammer you just because you did something wrong. Their goal is to educate to get compliance. So, but if you're an egregious violator, or you're just not going to comply, they do have the right to enforce that, including penalties and required abatement strategies.
All right. And for lab spaces in a university, if a student tests positive and is engaged in face-to-face lab activities that put them in close contact, less than 6 feet for more than 15 minutes with others, do the other students quarantine even if all parties have worn a mask and face shield?
Yeah, as I mentioned, labs have very specific requirements. So, perhaps the first stumped Sean answer that I'm going to give is that I'd want to do a little bit more digging into the lab space requirements specifically, because there are unique risk factors there. But if we're talking just cloth face coverings, we need to understand that, as I mentioned, we believe they're about, or the science is telling us that they believe they're about 70% effective in preventing transmission. Obviously, that's not 100. So if you're in close contact with somebody with just cloth face coverings, you're going to potentially need to isolate, because you wouldn't have had 100% protection from possible exposure.
All right. And are night cleaning staff required to wear masks when there are only 2 in the building?
So if they're working in an office setting, the requirements are under Executive Order 161 that you wear a face covering when you're in common areas, hallways, restrooms, break areas, etc. If there are cleaning staff in a building when they clean at night or whatever else, and they're in different parts of the building, they're going to need to wear those face coverings when they come into close contact. If they're working in a public space as cleaning, they're going to need to wear that mask all the time, as required in Executive Order 153.
Okay. And do current orders state that remote work should be implemented if work from home is possible? What if an employer refuses to grant work from home, but the role is 100% effective working remotely?
So Executive Order 160 is the one that most recently opened up different types of establishments in different regions and things like that. And that includes a requirement that if you are outside of regions 6 and 8, meaning that's like Northern Michigan, Traverse City area, and the UP, that employers must perform remote work to the fullest extent that they can. So employers should be evaluating which jobs can be performed remotely and which can't, remembering that the goal here is the congregation piece, that we have to avoid congregating in large groups. So the employer needs to make that determination. And if an employee believes that just because they should be working remotely doesn't mean that they can, it's a very, very delicate balancing act. But if they feel like their employer is violating the executive orders as it relates to workplace safety, they should consider filing a complaint with MIOSHA.
All right. And if an employee tests positive, what does the employer have to do to have the employee return to work?
So if they test positive, the CDC recommendations are that they are isolated for 10 days and that they return to, if they develop symptoms, it's going to be based on the symptom protocol. If it's just based on they tested positive but they never get symptoms, then the protocol is going to be slightly different. But the CDC for medium and low risk is recommending a 10-day period. And if you have symptoms, that you're 10 days plus 24 hours without a fever, without using fever reducing medication, and your symptoms have lessened without medication.
All right. And should a credit card machine be cleaned after each employee does a transaction?
So What I would encourage is that you need to enhance that cleaning, but make sure that you have sanitizer available to make sure those employees are sanitizing before and after. I would encourage you, if it's possible, to wipe it down before use and after use. It kind of depends on where that credit card machine is and you know, functionality and other things. But what we do know that you know, you can get it from touching it, so you definitely want to make sure that you're cleaning that thing as frequently as you can. That's practical within that workspace, and providing the cleaning hand sanitizer or the ability to wash your hands afterward if that's nearby.
All right. And the state requires conducting fire drills in dormitories for the fall semester. It will be challenging for residents in a large dormitory, over 1,000, to maintain social distancing outdoors during a fire drill. Are there considerations from BFS to waive or modify this requirement, or any other suggestions?
I think the suggestions, you know, this has been a question that's been coming up, is that if we're going to allow that many students to be in a building, that we have to practice the fire drill. You have to also remember that many of the students that are living in dormitories are freshmen. This is their first time away from home. This is their first time in an environment that they may not be used to. The importance of a fire drill is also so that they know where the closest stairwell is, so that they can use that. Having just dropped a child off at a young adult off at college, I watched folks wait for elevators to come when the staircase was right there, and some just to go down a flight or so. I don't think people necessarily, we're kind of creatures of habit. We go in and out the same way, and we don't necessarily look at all the components of the building. As far as for the social distancing outside, the requirement for college and universities is to conduct a fire drill within the first 21 days of classes starting. So the weather should be pretty decent. I think one of the things that, you know, we have RAs involved in such is to have where we disperse them out into a bigger area. And, you know, at a minimum, we keep sharing that, you know, wearing a mask, science says 70%. The idea here is, and I noticed that while being on a college campus the other day, that a lot of the kids, they're wearing masks. People are wearing the masks. So wear the masks, conduct the drills, please. You know, most of the reasons, or not most, the reason that there are drills in place for college dormitories, unfortunately, is in history, great losses of life from fires that have occurred in those buildings. So we are looking for you. There's a requirement for college and universities to run a drill in the fall, and you have to run a drill in the spring. Hopefully we'll get to spring and things will be a little bit different with COVID. We hope that. But there's a requirement to run a fall and a spring drill and a summer drill in the dormitories where you have folks. This question has come up though. We're not bringing any students back. If you're not bringing students back into those dorms, we're willing to work with you on. It's kind of silly to run a fire drill on an empty building. But if you are going to put students in dormitories, that requirement needs to be fulfilled, and that drill needs to be ran within that first 21 days, so that students know what it sounds like, students know how to move throughout the building, exit the building, and also it is a requirement that those drills have to be documented and have to be submitted to the Bureau of Fire Services at the end of the calendar year. So many of you didn't run drills in the spring because the campus closed in March. You're waiting till April to run the spring drill. We understand that. Sometimes the weather, but we need to make sure that, you know, we can make a notice for that. But if you have students back for this fall, there needs to be a fire drill. Thank you.
All right.
That's if I could add real quick, Erica, on that kind of that thought of like what you have to do and what you can do. I would encourage colleges to consider giving the RAs maybe a drill bag that has some masks available, recognizing that a lot of students are going to leave their room on a fire drill for sure without thinking to grab their face covering, and that might be something the RAs could distribute outside.
All right. And is employer-provided training for employees considered a social gathering or organized event under Executive Order 2020-160, Section 7?
No, in the workplace, that wouldn't fall under the 10-person limitation requirements, but it will require face coverings, 6 feet of space, etc. So depending on the makeup of the room that you might be using, I would encourage employers, they're going to have to do multiple trainings because they're going to need to maintain that space, and they're going to have to require, any in-person meeting requires a face covering. And it doesn't matter if you're 25 feet away, if you're in an office setting and you're in an in-person meeting, you need to wear a face covering. So employers might have to do multiple trainings, but certainly, social distance, face coverings, staggered trainings.
All right, and if employees file reports to MIOSHA about their employer and the response from the employer is satisfactory to MIOSHA, but nothing has been done or changed at the workplace, what options do the employees have?
So early in the crisis, like every employer in the state of Michigan has to protect their employees, MIOSHA was doing some remote investigations. Certainly if you file a complaint, depending on the severity of the issue, they're working to do on-site complaints to the maximum extent practical. One of the challenges, of course, is they're up about 500% in complaints in COVID. What I would encourage you to do is, if you hadn't spoken with that investigator prior to, give them a call or file another complaint for sure.
All right, and many guidelines state increased cleaning, which is very vague. How often should areas such as airport or rest area bathrooms be sanitized, assuming 100+ persons per hour?
So without just giving an answer off the top of my head, but a very high frequency bathroom like that's going to need very regular cleaning, and it could almost, in some cases, it'll almost be continuous. In some areas where you have a building where just a couple of people are going to be in there a day, which happens, it's going to be a different scenario. But certainly high volume, high use bathrooms are going to need regular recurring cleaning, and it's not going to be, the once or twice a shift anymore. It's going to have to be more frequent than that. And if you want to have a deeper discussion on that, I would encourage you to call that 855-SAFE-C19 so you can talk directly with MIOSHA on what their expectations would be.
All right, and what is the employer responsibility if employees' contacts are exposed? Just how far does the degree of separation go?
So I don't understand the question. So if
I think they're asking, if one of your employees was around somebody who tested positive, what should you as the employer do?
So what we're discussing as close contact, or what's in the executive orders or CDC guidelines, are within 6 feet of social distance for 15 minutes or more. So 2 employees passing each other in the hallway real quick, both wearing face coverings, that's not going to be considered a close contact. It's going to be when you're within that 6 feet of social distance and you're together for 15 minutes or more. And that's when the employer would kick in those protocols to, isolate the person with symptoms, discuss what the next steps for those folks that may have been exposed if they meet those definitions.
All right, and I'm aware of someone that continues to test positive for COVID-19. This person continues to go to work daily. They work outside, but there's the risk of exposing others. Does this mean the employer doesn't temperature test employees? And what can I do? Should I report the person or employer?
I would definitely file a complaint with MIOSHA, or at least give them a call at 855-SAFE-C19. The only reason I can't give you a definitive answer is because if they're working in certain industries like healthcare, there are some differences with CDC and other stuff on how those things work. But generally, definitely call MIOSHA, have that discussion, and move potentially to the complaint process. In certain industries like meatpacking, casinos, and manufacturing are required to do temperature testing. Other industries are encouraged to do that to really help flag those potential COVID cases.
All right, and the executive order requires certain records be maintained. How long must they be maintained?
So MIOSHA is working through this on their FAQ right now, but there are, for the daily health screenings, it's looking like we're going to expect you, or they are going to expect you to maintain those records for a significant amount of time, but we expect to have an answer, a specific answer to that on our FAQ soon. But for now, I would say just keep them all.
All right, and that brings us to our last question we have. So I'll read this one off, Sean, and then after we have an answer, I'll let you close things out. In future events like this, is there a plan to include experts involved with contact tracing?
We can certainly do that. Yeah, absolutely. And we can do specific ones. We've offered already before in previous calls to host. We do a normal FAQ session outside of just college towns. And one of the questions there was healthcare. So we're working with the MIOSHA folks on setting up a specific healthcare issue. We can certainly work with the contact tracing groups on the contact tracing pieces to really help hone in on those issues. Those are things that we are doing and trying to do. So we appreciate the suggestion, and absolutely.
All right, we actually did get one last question here. Does a restroom get sanitized after a person uses it?
Not necessarily after each individual, but the employer would need to increase the frequency of cleaning to make sure that they are, depending on the volume of that restroom, doing what they need to do. And then us as humans, as I talk about taking ownership, we need to make sure that we're, doing what we can do in that space as well.
All right, that's all we had today, Sean. So I'll turn it back over to you to close things out.
Well, I appreciate everybody joining us today. As we discussed, I mean, there's a lot that we're all learning. There's a lot that we're all doing, and there's a lot of pieces that we're going to continue to be putting in place. So I would encourage you to check back with the Fire Marshal and the Liquor Control Commission for things they may be posting, as well as our COVID Workplace Safety website, because that's where we'll be doing all of our updating. Those guidelines for many industries have been up for a long, long time now, and we continue to update those as executive orders change, as CDC guidelines change. So make sure you're checking back there frequently. Do not hesitate to give 855-SAFE-C19 a call if you have questions about your workplace and workplace safety things that you could or should be doing. We're absolutely trying to learn and educate together to make sure that we're hearing from you and you're hearing from us to the maximum extent possible to make sure we're doing it well. As I mentioned at the outset, we all have a stake in this because we all want to get open and stay open. And that means all of us as individuals, as well as what we can do and the things we can control in our workplaces, we need to be doing those things to make sure that we're moving forward in our containing COVID, our fight against containing COVID. Make sure you're engaging with your local public health, local municipal leaders, local authorities on things that you're seeing that may need to be adjusted moving forward to help disperse those crowds. Those pieces I mentioned that have been static, that social distance, face coverings, and hygiene, reinforce them every single day, because those are the tools that help us contain COVID. So we have to be doing that. And we have to recognize that, as human beings, we get together. Even though I might consider myself an introvert, this is too lonely for me, right? So we like to get together and we like to group together, and that's just something we can't do right now above what the executive orders say. So let's make sure that we're doing it right, make sure we're abiding by those things, and keep driving our numbers down. We're seeing some good progress in most of Michigan. Certain areas are having spikes right now that we are really concerned about, but those pieces there, that social distancing, masking, and hygiene, are the tools that we have that you can control, that we really need to be reinforcing and making sure that we're doing. So as I mentioned, you've self-selected to join us today. Make sure you're pushing this out in your own network, whether it's your family, other businesses, or anywhere in your community, to make sure that we're all engaged to contain COVID. And we will check back as much as we can. We're happy to talk anywhere that we're wanted, and I appreciate the time that you spent with us, and I hope you found it informative. And thank you, and keep up the good work.